Hi everyone, this video is about using elimination method to solve CPC exam questions. Elimination method is a powerful strategy for tackling multiple choice questions on the CPC exam. Remember, the CPC exam is time limited, so quickly eliminating wrong answers can save your valuable time. And also, elimination method reduces errors. At times when you are unsure of exact answer, elimination method will be helpful for you because by eliminating incorrect answers, you can focus on most likely correct ones. Let us use elimination method to solve this question quickly. Before looking at the question, we'll look at the options. Check option A 87040, that is for culture bacterial blood aerobic with isolation and presumptive identification of isolates. And option B 87070 is for culture bacterial any source except urine, blood or stool aerobic with isolation and presumptive identification of isolates. And option C 87075 is for culture bacterial any source except blood anaerobic with isolation and presumptive identification of isolates. And option D 87088 is for culture bacterial with isolation and presumptive identification of each isolate urine. Now let us see what exactly they have mentioned in the question. A quantitative colony count bacterial culture of the urine was performed with isolation and presumptive identification of isolates. So which among these four codes is the right one? The right code is 87088, which is in option D, because that is for culture bacterial with isolation and presumptive identification of each isolate urine. In the question you can see they have mentioned bacterial culture of urine with isolation and presumptive identification of isolates. We'll eliminate option A because that is for culture of blood specimen, right? And we'll eliminate option B because they have mentioned any source except urine. But in the question they have mentioned urine. So we cannot code 87070. Option B is eliminated and option C 87075, that is for culture bacterial any source except blood anaerobic with isolation and presumptive identification of isolates. That is for anaerobic. Okay, in the question they have not mentioned anaerobic, so we cannot use 87075. The right answer is option D. Let us solve another question. Let us directly look at the options. In the options you can see many codes. So first we have to check the first code from each options. So let us check option A, first code 96374. 96374 is for therapeutic prophylactic or diagnostic injection, intravenous push, single or initial substance or drug. And in option B and C the first code is 99601. Check the code. 99601 is for home infusion specialty drug administration per visit up to 2 hours. And in option D, the first code 99243 is for office or other outpatient consultation for new or established patient which requires medically appropriate history, low level of medical decision making. Now let us check what exactly they have mentioned in the question. They have mentioned Mr. West is recovering at home from a post-operative wound infection. A home health nurse administered IV cephalosporin, an antibiotic. This IV administration and home health visit lasted for 4 hours. Okay, so which among these three codes is matching with the main terms in the question? 99601, right? Because that is for home infusion specialty drug administration per visit. And in the question they have mentioned home health nurse administered IV cephalosporin, right? Therefore the appropriate code is 99601. By this we can eliminate option A and option D, because if one code is wrong the entire option will be wrong. Since the IV infusion was provided in the patient's home, we cannot code 96374. So eliminate 96374 Therefore, we'll eliminate option A, and option D is for office consultation. That is wrong. So we'll directly eliminate option A and D without thinking much. Now we are left with option B and option C. In option B, they have mentioned the code 99243 again. So that is not the right code. Therefore, option B also will be eliminated. Option C is the right answer. And the code 99602 is for each additional hour. In the question, they have mentioned the home health visit lasted 4 hours. Therefore, up to 2 hours, we'll use the code 99601. And for each additional hour, we'll use the code 99602. Therefore, for 4 hours, we have to use 99601 once and 99602 twice. Therefore, option C is the right answer. So that's it for today. Don't forget to show your support to my channel by liking, sharing and subscribing to CodeMail Mastery.